Good evening, everyone. I hope I'm live now. So, as usual, we will wait like few seconds until the notification gets to people, and then we will discuss the topic that you guys suggested. And if you, as always, if you have any question, please leave it in the live chat. Okay, so today we have multiple questions. We have actually 7 questions that are suggested by people that follow me on Instagram. It's related to, as you can see from the title of the live stream, it will be related to affordable skincare versus like a luxury one, and do affordable skincare works. Uh, More about animal testing in cosmetics, dry lips advice, and tips for saving up money when you are trying to buy skincare. Um, Concern about chemical sunscreen being absorbed into the blood, which is a valid concern, and I will explain why you shouldn't be afraid of it. And then we have cosmetic versus drugs versus OTC drugs. And then we will have to talk about how to get into skincare world like professionally, what kind of academic path you can take to be able to like dive deep into the details and all the information about skincare. So we will start in a little bit about those topics, and of course, as always, if you have any question, please leave it in the live chat here on the live stream. And I hope it's working because it says I'm live. Okay, I will start with the first question. Let me check. Yeah, I will start with the first question. So, do affordable skincare works? Why some skincare are more expensive than others? Okay, so affordable skincare do work. Affordable skincare showed us, always showed us, and it will always show us that it works. Products doesn't have to be expensive to work because it will be tested for safety and quality, and every cosmetic is tested for safety and quality, but the efficacy could be should be on the hands of the manufacturer of the product. So and why some products are more expensive? Because it can be, like for example, I can explain. CeraVe is a very kind of affordable option, ordinary affordable, versus Estee Lauder, which is very expensive, Niod from Decium, which is more expensive. Those differences in prices could be to formulation. The formulation in the expensive cosmetic product can be more elegant, gives like this dewy finish after finishing. We don't deal with pilling up, maybe some bad perfuming, some other, but the safety and quality should be identical. So the affordable product should not be more risky than or pose more hazard towards your health in compared to expensive product. And there is also the quality of the provider of like primary ingredients. All of them should be have a specific purity, should be free from like contaminant or other type of chemical that could harm your skin. Both of those should be like safe, like I said, and good quality. But some manufacturers prefer to get their primary ingredients from a more expensive source, and the formulation, and also you are paying for the name. And some expensive product have patents, like for example the SkinCeutical CE ferulic acid. It's a $166 vitamin C serum. It was backed by a clinical study which costs a lot of money, so you are paying for this as well to make sure this product is effective. So the affordable skincare works, the expensive skincare also works. It's a decision you have to make. If you are able to go for expensive, go for it. If you have the money to go for expensive and you decide for affordable, go for it. Skincare is about testing and trying out, so there is no difference between expensive is definitely better or affordable is definitely worse. It's about like a balance between those two decisions that you have to make, and that after all it's your money, so you have to decide what's good for you. So like I said, as a final word for this question, safety and quality of both of the affordable and expensive or luxury skincare should be maintained, because it is required by the regulatory laws to have assure safety and quality. The efficacy can be different. We don't know. Some companies prefer to do clinical trials, some don't. So that can affect the pricing. And the second question is more about animal testing. Animal testing, like I said, if you don't follow me on Instagram, please check it. I go into deep details on this topic with my post. I mentioned resources and references that you can go and even go deeper than this, but hopefully those posts will be enough. So yesterday I posted about alternative method to animal testing. So method that the cosmetic company are leaning towards now. So they have animal-free testing. As we all know, in the European Union in 2013, animal testing was banned on cosmetics ingredients and on the cosmetic product as a finished product. So this ban pushed companies and regulators to find alternative method to test on animals. Those alternative method test for cytotoxicity, genotoxicity, phototoxicity, and many other. And I explained everything in that post. But there is a dilemma. So that is, those alternative method will never, currently, we are talking currently, can never fully replace the animal testing. Okay, now we don't test on animals anymore for cosmetic product, but pharmaceutical product and drugs and biotechnological product, we test on animal. We need this. We can't replace it now. It's a major point for safety, so you can take your drug or any kind of medication with 100% safety. The cosmetic is not as essential as drugs, so they banned it, animal testing on that. But those alternative method is not as on the level to provide good, robust results to replace the animal testing method. So the scientists and regulators have to find ways of getting back to like scientific literature to draw information from the other type of studies, other type from old studies as well. So alternative method right now helps in a way to reduce the animal testing. In cosmetics, we don't test on animals anymore in the European Union, but it's those alternative methods are not there yet. So scientists have to do extra work to make those results more robust. So that's the point that I want to clear up. And as my personal opinion, it's not really ethical to test on animals, but at the same time, it's not ethical to test on humans as well. So we have a dilemma. So animals, humans, we have to choose. Drugs and medication have to be tested on animals to assure safety before moving to test on humans. So it's a process of moving between species to help us achieve the most secure or most safe or the safest drug possible for our human consumption. And those animal trials helped a lot with vaccination. The COVID vaccine was tested on animals because without those, like without testing on animals, we don't have a really alternative method. And I'm talking about drugs right now. Cosmetics, we are trying to do it. We are on the right way. It will take a lot of time, but when it comes to drugs and the medication, it's still I don't know if it's a problem. It's a dilemma. Let's call it dilemma. So testing on animal give us a very positive feedback. It's not really ethical, but it saves a human and it saves souls. So a lot of work has to be done regarding this issue. So dry lips advice and recommendation. Okay, so dry lips. I remember doing this as my first TikTok ever. I'm not really active on TikTok because I don't understand it really well, but I recommended those two products. They are by my side. So what you have to do is this following, and it will like change your life. So you have to wet your lips a little bit with water, whatever, then apply a balm. I recommend the La Roche-Posay. I don't know if you can see it, but it's like it's not showing at all. So La Roche-Posay Cicaplast Balm B5. It should be like showing here. So this is it if you can see it. Apply a thick layer on it. Make sure it's absorbed a little bit. Then go with a very thick and occlusive lip I forgot the name of this, but it's a Labello lip balm in a way as well. It's so thick that it will cover create a physical barrier to maintain hydration in the lips. So those two combination literally changed and saved my lips in winter. You should try it and make sure that it's those both ingredients because like I said, and the video will be up soon, sorry for being late, but I had exams and other things. But the Cicaplast contain amazing amount of soothing and healing and repairing ingredients, so it will help your lips to stay very hydrated. Plus it's very thick, so it will be occlusive and maintaining hydration, so it will be the best advice I can ever. I don't usually recommend the product, but those two I can be 100% sure to recommend it for you. So the fourth question is tips for saving up money when buying skincare. So a lot of people fall for the marketing scheme of companies. Uh, let's say they push a star ingredient, for example, niacinamide. They put it in a cleanser, they put it in a toner, they put it in essence, they put it in a serum, they put it in the moisturizer. You need to find what is perfect for you. Like I need a serum that contains niacinamide. Okay, I can get the serum. That's it. You don't have to get all the whole line of the skincare company. You don't have to pay that much money. Second advice, I usually do save your money series here on YouTube on shorts. After this live, you can check it out. I made one short that is doing very well because people like really like the advice. Is that I turned the CeraVe hydrating lotion, the big and cheap one with a pump, to CeraVe PM facial lotion. They are both exactly the same. The only missing ingredients between the two are niacinamide. I did the calculation and how you can add niacinamide by adding the niacinamide powder from the ordinary, the tub, how much you add to the big hydrating lotion, and you will get exactly same formulation of the PM lotion, which will be a little bit thicker than the hydrating lotion, but it would be amazing. And a lot of people like the idea and tried it, and it was amazing. So if you want to check out and check how much you add, I did all the math. I checked the pH and the formulation, nothing will go bad. And the short here in then it will be a very good advice, because the PM lotion is quite expensive compared to the hydrating lotion. You will get almost 5 times more the amount of the PM lotion with the same price. So it's a very, very good advice to save money. And the last tip for saving money: don't feel pressured or bullied if you saw someone using an essence online, or look what your skin needs, look what your skin really wants. Okay, I'm missing hydration, I need to look for humecting. Go for something affordable. It does hyaluronic is hyaluronic acid. It's not going to change between companies, between the quality of it, because most company wants customers to stay customers, so it's about money. They won't put like a bad hyaluronic acid, or they don't put hyaluronic acid at all. It's about just the formulation, the sense, the experience of a luxury product. So those are my tips. So the fifth question is about concern about chemical sunscreen being absorbed into the blood. So a lot of drama happened in the past few months about chemical. Even dermatologists, unfortunately, some really educated people were jumping on the like the bandwagon of, okay, chemical sunscreen absorbed into the blood, blah blah blah. And unfortunately, some like dermatologists were using this study that found, okay, traces of chemical sunscreen in the blood and the urine of some humans is something that will cause a problem, and they used it to sell their own product and saying it doesn't absorb to the blood. The data until now, according to the Scientific Committee for Consumer Safety, the European organization, is that it's not an issue. The concentration are so minuscule. I don't remember the exact amount, but I think it was a nanogram or even picogram, which is way less. I can't remember the exact number, but it's so low. And I even have, I think, on Instagram a video about it, and here on YouTube. So you don't have to be afraid of it. It's not going to cause, even if it's absorbed into the blood, it will be metabolized by your liver and excreted in the urine, and nothing else will happen, because the last report of safety report from the Scientific Committee of Consumer Safety of Europe. It was in 2017, I believe. I'm not very sure. But it was saying that it is totally safe. There is no concern until now. There is no data suggesting that this chemical will cause any genotoxic or carcinogenic effect. So you don't have to worry about this. It's not a big deal. We will find out in the future, after more studies will be done, if there is a long-term effect, but until now the data shows nothing to be afraid of. So the sixth question is about cosmetic versus drugs versus OTC drugs. And hopefully I can answer very well, because if it's related to okay, I will explain it as best as I can. So cosmetic products are regulated in a way to assure, like I said, safety and quality. The efficacy is something like handled by the manufacturer. Okay, so does it really work or not? So the cosmetic, you might be playing with, does it actually work, or does it actually like effective or whatever? But some cosmetic products are effective. We've seen result with a lot of people. Like for me as a pharmacist, I've seen a lot of people using cosmetic product to treat acne, to treat other condition of the skin like eczema and etc. So cosmetic does work, but they are less regulated compared to drugs and OTC drugs, because the regulation system put a lot of the burden on the manufacturer. That's the issue, which I believe needs a little bit of fixing and tweaking. The cosmetics, like I said, only checks the safety and quality, and that's it. Efficacy can be yes or no, good or bad, we don't care, but it's make sure that it is safe and done quite good. The drugs are the most regulated and strict, like a product in the market, because you can't just create a drug and push it in the market. It has to go through a lot of testing, through clinical trials, need marketing authorization. So you can't just grab whatever you want and put it in the market. It needs to be authorized by the regulating bodies and the regulating system of the country. And OTC drug is as well. But what's different between those three are the risk. So the cosmetics usually does not pose so much risk, so the regulation around it is less strict. But the drugs and OTC drugs comes at the highest amount of risk. That's why it need to be taken under the medical supervision of a medical provider, whether it's your doctor, pharmacist, or nurse. You need someone to be monitoring you when you are taking those drugs. The OTC drugs, they don't regularly need the prescription, because they are OTC, which mean over the counter, but they are still drugs. They still need to be regulated, stricter than cosmetics, but less strict than drugs. So when it comes to strict regulation, it will be cosmetics, OTC drugs, and drugs. And some countries put the drugs and OTC drugs in the same category and have a very strict regulation, because they are drugs, and the risk increase when the risk increase, we increase the regulation. So cosmetic not really have a very good or a very good chance to cause any problem, so it's kind of risky. So the regulation are not that strict. OTC drug, okay, we need to take specific dose and follow the manufacturer instruction how to use this drug and how to take it. So more strict regulation, stricter regulation. And the strictest or the most strict regulation will be for drugs, because we need someone who is professional monitoring you while taking this medication. And the last question, which is kind of, I was asked about it quite a bit, which is how to get into skincare. So what kind of what kind of degree you have to take to be able to speak about skincare with, like, I don't know, confidence, or feel comfortable to talk about skincare. So this question is quite interesting. There is no specific path you can take to be able to talk about skincare, but background in biology, molecular biology, biochemistry, anything related to chemistry, organic chemistry, anything related to the human body, the studying of anything into the medical field, help you or give you the tool to be able to dive deeper into skincare without being afraid or without falling into the false information and misinformation. So, and I was asked also to do suggestion of what you have to do. For me, I took a 2 years diploma as a lab technician for medical diagnoses. Then I studied 5 years as a pharmacist. Then now I'm doing my master in safety assessment of xenobiotic and biotechnological product and toxicology. So I talk about more about skincare, science behind skincare, thanks to my bachelor, and the regulation thanks to my master. So you can start as a chemist, study 4 year bachelor, and then go into the cosmetic field. That's okay. A biochemist, molecular biologist, anything related to biology and chemistry can help you have the foundation for it. If you don't want to have a degree, there is some online courses that for an institute called Institute of Personal Care Science. I think it's based on based in Australia, I believe. I'm not very sure. This company or this institute help you to get online education to be a cosmetic chemist, which is amazing. Help you to know how to formulate, how to make creams, ointment, gels, cleansers, and whatever. And it's I think it's online, and it could be in hybrid method, so online, and if you are in Australia you can attend classes in present, and it will give you a certificate to be recognized as cosmetic chemist, and it's I think it's worldwide. Um, I forget the word, but recognized by a lot of industry organizations. So you will be a cosmetic chemist. It will be, I think, 2 years. I'm not sure very much, but the name, I repeat it again, it's the Institute of Personal Care Science in Australia. I think some people did it, which like there is a very good reviews about it, but it's a quite good institute. And like I said, there is no definite path to go into skincare, but it depends on what you want. Like if you want to treat skin, you can have study and go into a esthetician school, or if you want to treat and understand pathology of the skin and treat more severe cases, you can go into medical school and specialize in dermatology. If you want to just understand about the skin in general, have basic information about pathology and understand formulation, understand chemistry and drugs, you can go to pharmacy school. If you want to go into formulation, understand how things are made, you can go to cosmetic chemist program. And lastly, if you want to study or know about the regulation and how we assure that cosmetic product, drugs, and pharmaceuticals are safe, you can go to like safety assessment program or whatever. So it's very big field, and I hate to use this word, but it's there is no one in the like in any field can be considered a skincare expert, because you need all of those people. I made also a video, you can check it on the channel, about knows better about skincare. I try to be as respectful as possible, but everyone in the skincare community like is needed to have this community. Like dermatologists are specialized in treating skin and understanding pathologies like acne, severe acne, etc. Cosmetic chemists are the people that expert in formulation, what we should mix and not mix, how things are made, and how some product perform better than others. For example, for pharmacists, I am trained for hours and hours and hours, thousands of hours, how to communicate with the patient, help him or her with the medication interaction. I also depends on the country's laws. I'm also authorized to treat moderate to mild cases of acne with my OTC prescription. So it depends on, everyone is needed. Also, some people goes to say that even skin influencer, that people who are not maybe have the academic background, also are important to tell us how this product is performing in real life, because it's a part of the product. Okay, on paper it's amazing product, it's ingredient list amazing, formulation is perfect, but when it comes to real life performance, it's a bad product. So those people are also very important as any as all the part of the skincare community. We all need each other to have a balanced way of skincare. But some people, I don't know why, looks for drama. Okay, dermatologists are the skin expert, or cosmetic chemists are the skin expert, or esthetician are the skin expert. There is no one called skincare expert. There is no one. I don't call myself skincare expert. No one should call them skincare expert. Skin expert can be like, as a word, skin expert can be called for the maybe dermatologist, because they dedicate their life to study the skin, but that doesn't give them the expertise to talk about formulation, or saying, okay, this is going to be bad in a product, or this is gimmicky, or you are not trained to understand those things because you haven't studied them. Like I said, don't go after a dermatologist and say, okay, you did this Botox injection wrong, or this filler wrong, or this laser, fractional laser wrong, because I'm not trained on those things. That's the issue. So getting into skincare can be a multi-path way, and you can go do it any way you find more interested in specific section or specific field in the skincare community. So those are my questions. So if you guys have any question, please leave it in the comments. I will take my break now, and I will wait a few minutes. If you don't have a question, I will end the live stream. And like I said, the videos will be up very soon, hopefully. The La Roche-Posay one, the Botox in a Bottle one, and the PR that I got. I'm using it for 2 weeks, and I will see the result. But from the first impression, I think I'm liking it. It's different. It's the formulation is different and interesting, and I will give you the full review about this product. So please, if you have any question, I will wait a few seconds. If you don't, I will have to say goodbye to you and end this live stream. Okay, so it's look like there's no question. So again, see you guys next week. Maybe I will post a video during the week about the La Roche-Posay one. And please don't forget to be safe, get vaccinated, and don't forget your mask. And I see you next week.